Support comes from Missouri Forest Products Association, committed to sustainable and sound conservation of the state's forests, which support more than 41,000 Missouri jobs, resulting in a $10 billion industry. ChooseWood.com.
Welcome to St. Louis on the Air. I'm Sarah Fenske. Both Illinois and Missouri have created programs for patients to access medical cannabis. And in both states, yes, you will need a prescription before you can toke. But some of the similarities end right there. One state has been doing it a while, the other is just getting started. One makes it easy, and one makes it actually pretty hard. So here to help you sort out the cannabis landscape is St. Louis Public Radio reporter Jaclyn Driscoll. Her report on this subject aired earlier this week, and it's now live on our website. Jaclyn Driscoll, welcome to the program.
Thank you.
So you started by quantifying the interest in Missouri's medical marijuana program. It's all very new at this point, but how many people have signed up?
Right. There's a lot of people that have already received their medical cannabis cards. As of Friday of last week, which I haven't checked this week, but there were more than 17,000 patients that were already in the medical program. And they just began approving patients at the end of June, early July. So a lot.
That seems like a pretty large number. Were they anticipating that level of interest?
I think that they were prepared for it, just by the way of design, how they set the program up, and how pretty much it's very easy for patients to gain access into the program. I think that they did anticipate a large interest in it, especially how it played out at the polls, where the medical cannabis constitutional amendment was passed through the voter referendum. So I think they anticipated that there would be a lot of interest in it.
Voters definitely were in favor of this thing. So now with these cards that they've got, what did they have to do to get them, and what will they have to do to actually get their hands on some marijuana?
So right now, there is no legal way to purchase cannabis in the state because none of the dispensaries or cultivation centers are up and running. But it is legal to have it in your possession right now. So essentially, people are buying it probably from the black market, but we don't want to be naive in thinking that that's not already happening, because it is. We already know that the cannabis industry is alive and well. But to get a medical card, you simply have to go to an MD that's in good standing with the state of Missouri, and they can certify you for cannabis. It's actually not a prescription because it is still federally illegal. So they don't prescribe cannabis. They just certify that you have a debilitating condition or qualifying condition that would okay you for the use of cannabis.
Okay. And so these people have gotten their physicians to do that. They've filled out this paperwork. And once somebody's willing to sell to them, they can then legally purchase.
They can. And if they have found a way to buy just the seeds, they are actually legal to grow it at home, up to 6 plants per cardholder, if they have their home grow permit.
So you mentioned that none of these dispensaries are up and running yet. What kind of timeline are we looking at for them to be ready to start selling?
So the department is they are scoring applications right now. The state received an influx of medical cannabis facility applications. They are set to approve or deny those facility applications by the end of December, beginning of January. So the timeline right now is spring 2020, early summer 2020 for the dispensaries and the cultivation sites to be up and running.
Okay. Now, Illinois' program has been going for a few years now, but as we mentioned in the introduction, it has a much different setup. Here's what State Representative Bob Morgan, he's a Democrat representing Chicago's North Shore suburbs. Here's what he told you about that.
And the only way we were able to pass it was to make it not just one of the strongest, but one of the most restrictive medical cannabis programs in the country.
That's Bob Morgan. So this was something that went through the legislature as opposed to being approved by voters in the state. How did that end up affecting the parameters of this program?
Right. So Illinois' constitution actually doesn't allow for the voters to do this. So it had to go through the legislature, just like everything else does. But as we know in politics, there is give and take. Also, I want to point out that Illinois was one of the earliest states to pass a medical cannabis program. It was introduced in the legislature in 2013. So the stigma surrounding cannabis has just shifted greatly since then. anyway. But it was a very strict program. Doctors have to have a bona fide relationship with their patient. You can't just go to any doctor to have them certify you for cannabis. You have to have an ongoing relationship with the doctor. And the list of qualifying conditions was very small. For instance, chronic pain wasn't on Illinois' list of qualifying conditions until just this last legislative session.
So they have put some tweaks into this law to make it a little bit easier for people to qualify?
They have. They've made it a little bit easier, but also when Illinois passed the program first, it was just a pilot program that was scheduled to sunset. So now it is a permanent program. But yes, they've also added several qualifying conditions to make sure that people are able to get cannabis.
Now, you talked to Dan Vietz. He's a cannabis advocate with NORML who helped to write the constitutional amendment here in Missouri. And he explained one component of Illinois' law.
Many hospitals forbid the doctors who work with them from qualifying patients for cannabis. So those patients who have a so-called bona fide relationship with a doctor may very well have that relationship with a doctor who is forbidden by his or her employer from qualifying that patient for cannabis.
That's Dan Vietz. Is this something that Illinois was concerned about or felt that was a hitch to this program, that physicians just weren't willing or weren't able because of their employer to write these prescriptions?
This was a huge problem when it first started. Actually, when I was in Springfield covering the state capitol there, I think both of the major hospitals had clauses in their hospital policy that forbid any doctors from certifying patients. So patients were having a lot of difficulty in accessing medical cannabis or finding a doctor that they'd had a relationship with that was legally able to certify them. Now, again, as we mentioned, that stigma totally shifted. I think I believe one of the hospitals, maybe both at this point, do allow their doctors to certify in Springfield. Certainly one of the two. I would have to double check because I'm not in Illinois anymore. But it is getting easier. It's not as big of an issue, but Illinois maintains that bona fide relationship with patient-physician is crucial, and they don't plan on changing that anytime soon.
Okay. And do we have a sense of how many Illinois people are currently using medical marijuana?
It has gone up recently. I'd say mid-2018, it really took a spike. And I believe right now there are about 77,000 patients. That also increased because Illinois passed the opioid alternative program. So any patient that could have been prescribed an opioid, they can now have that certification for medical cannabis as well. So they really saw an increase once they passed that program.
Okay. Well, it's very interesting to learn about what's happening in Missouri and all these changes that have been playing out in Illinois. So Jaclyn Driscoll of St. Louis Public Radio, thank you so much for joining us today.
You're welcome. Thank you.
This is St. Louis on the Air on St. Louis Public Radio, 90.7 KWMU.
Support comes from the Missouri Forest Products Association. Missouri produces wood pallets, railroad ties, white oak barrels, hardwood floors, and more. Details on the variety of products made in the state are at choosewood.com.